Imagine a young college student, anxious and unsure, seeking help from a therapist. The student, raised in a collectivist culture where family harmony is paramount, is struggling with making independent decisions. The therapist, however, primarily views the world through an individualistic lens. The therapist interprets the student's hesitation and deference to family as signs of weakness or a lack of assertiveness. This misinterpretation leads to advice that clashes with the student's deeply held values, causing further distress and misunderstanding. This scenario, unfortunately, is not uncommon. It highlights the critical need for multicultural competence in psychology. Multicultural competence, in the simplest terms, is the ability to work effectively with people from diverse backgrounds. It's about understanding and respecting the cultural backgrounds, values, and experiences of others. This understanding goes beyond simply knowing facts about different cultures. It involves actively challenging our own biases and assumptions. According to Su and colleagues, there are three main components of multicultural competence: awareness, knowledge, and skills. First, cultural awareness requires us to understand our own cultural beliefs and values. This self-reflection helps us identify potential biases that might influence our interactions with others. Second, cultural knowledge involves learning about other cultures, their histories, and their perspectives. Finally, cultural skills refer to our ability to use our knowledge and awareness to interact effectively with people from diverse backgrounds. This includes using appropriate communication styles, being sensitive to cultural differences, and adapting our approach as needed. In an increasingly diverse world, multicultural competence is no longer optional, it's essential. This is especially true in the field of psychology, where professionals encounter individuals from all walks of life. A therapist who lacks cultural understanding risks misinterpreting a client's behaviors, values, and experiences. This can lead to misdiagnoses, ineffective treatment plans, and further marginalization of already vulnerable populations. Consider the case of mental health disparities among minority groups. Research shows that individuals from racial and ethnic minority groups are less likely to seek mental health services, and when they do, often receive lower quality care. This disparity is partly due to the lack of culturally competent providers who can understand and address the unique needs of these populations. The American Psychological Association's ethical code explicitly addresses the importance of multicultural competence. Psychologists are ethically obligated to provide services that are sensitive to the cultural backgrounds of their clients. This means taking the time to understand their clients' cultural values, beliefs, and practices. It also means using assessment tools and treatment approaches that are culturally appropriate. Failing to adhere to these ethical guidelines can have serious consequences. It can lead to harm to clients, damage to the reputation of the profession, and legal repercussions. Multicultural competence, therefore, is not just about being a good therapist. It's about fulfilling our ethical obligations as mental health professionals. One of the most significant barriers to multicultural competence is our own unconscious biases. These are implicit attitudes and stereotypes that we hold about others based on their race, ethnicity, gender, sexual orientation, or other social identities. We may not even be aware of these biases, yet they can subtly influence our perceptions, judgments, and behaviors. For instance, we might unconsciously associate certain racial groups with negative stereotypes, leading to biased treatment. Or we might unknowingly favor individuals who share our cultural background, creating an unfair advantage. The first step in addressing our biases is to acknowledge that we all have them. We must be willing to examine our own beliefs and assumptions, no matter how uncomfortable it may be. Interacting with people from diverse cultures can sometimes lead to misunderstandings or conflicts. These situations can be challenging, but they also offer valuable opportunities for growth. Su, in 2001, proposes a framework called the 4 F's to understand common cultural responses: freeze, flee, fight, and fright. Freeze involves feeling stunned or paralyzed when confronted with cultural differences. Flee refers to the urge to avoid interactions with people from different cultures altogether. Fight involves responding with anger, defensiveness, or aggression. Finally, fright encompasses feelings of anxiety, fear, or overwhelm. Recognizing these responses in ourselves and others can help us navigate cultural differences more effectively. Developing multicultural competence is a lifelong journey, not a destination. It requires ongoing self-reflection, education, and engagement with diverse communities. Here are some ways to embark on this journey. Engage in self-reflection. Regularly, examine your own cultural values, beliefs, and biases. Ask yourself how your background might influence your interactions with others. Seek cultural knowledge. Learn about different cultures through books, articles, documentaries, and conversations with people from diverse backgrounds. Attend cultural events and engage with your local community. Develop cultural skills. Practice active listening, empathy, and perspective-taking. Learn how to communicate effectively across cultures and adapt your approach as needed. Seek supervision and consultation. Regularly consult with colleagues, mentors, or supervisors who have expertise in multicultural competence. Seek feedback on your work and identify areas for growth. In conclusion, multicultural competence is not just an option for future psychologists, it is an imperative. It is about ethically and effectively serving all individuals, regardless of their background. By embracing cultural humility, continually learning, and actively challenging our biases, we can create a more just and equitable world for all. Remember, the journey towards cultural competence is ongoing and requires constant effort, but the rewards, both personal and professional, are immeasurable. Gap 2S. While understanding the importance of multicultural competence is crucial, applying it in real-world therapy sessions is equally vital. Let's discuss some practical applications and best practices. First, active listening is essential. Therapists should make a concerted effort to understand their clients' cultural contexts. For example, when working with a client from a collectivist culture, it's important to acknowledge the role of family and community in their life decisions. Next, therapists should adapt their communication styles to meet the cultural preferences of their clients. For instance, some cultures may value nonverbal communication and emotional expressiveness, while others may prioritize verbal articulation and emotional restraint. Being attuned to these nuances can foster better therapeutic alliances. Another best practice is to integrate culturally relevant examples and metaphors in therapy. For example, using stories or analogies that resonate with a client's cultural background can make therapeutic concepts more relatable and impactful. Therapists should also be mindful of cultural variations in expressing distress. In some cultures, psychological symptoms may manifest as physical complaints. Recognizing these differences can prevent misdiagnosis and ensure appropriate treatment plans. Lastly, ongoing education and supervision are key. Therapists should seek training in multicultural competence and consult with colleagues to navigate complex cultural issues effectively. This continuous learning helps maintain cultural sensitivity and improve therapeutic outcomes. In summary, applying cultural sensitivity in therapy involves active listening, adapting communication styles, using culturally relevant examples, recognizing cultural expressions of distress, and pursuing ongoing education. By implementing these practices, therapists can create a more inclusive and effective therapeutic environment for all clients. Gap 3S. Thank you for watching, and remember, the journey towards cultural competence is a lifelong commitment that enriches both personal and professional lives. Let's explore real-world case studies highlighting the significance of multicultural competence in psychology. Case Study 1, The Power of Active Listening. A therapist shifted to active listening, understanding an East Asian client's anxiety rooted in family expectations. This led to significant improvement in the client's well-being. Case Study 2, Adapting Communication Styles. A therapist used nonverbal cues to help a Middle Eastern client open up. This built trust and improved therapeutic outcomes. Case Study 3, Integrating Culturally Relevant Examples. Using cultural metaphors made therapy more relatable for a Native American client. This adjustment led to a more effective therapeutic process. Case Study 4, Recognizing Cultural Expressions of Distress. A therapist recognized physical complaints as psychological distress in a Latinx client. This led to a more accurate treatment plan. Case Study 5, The Importance of Ongoing Education. Continuous education in multicultural competence enhances therapy. These case studies show the power of multicultural competence in therapy. Thank you for watching. Remember, cultural competence is a lifelong commitment. To support therapists in their journey towards multicultural competence, various tools and resources are available. These include training programs, literature, journals, and online platforms. Organizations like the APA and NMI offer workshops and seminars. Key texts and journals provide comprehensive insights and latest research. Online platforms and professional networks offer valuable resources and collaboration opportunities. Mentorship and self-reflection tools help therapists continually improve their cultural competence. Utilize these resources to provide inclusive care and create multicultural environments. Thank you for watching. The future of multicultural competence in psychology is evolving with new trends and research. Intersectionality emphasizes the multifaceted nature of cultural identities. Understanding these identities is crucial for effective care. Technology like virtual reality enhances multicultural competence. Culturally adapted therapies align with community values. Addressing mental health needs of marginalized communities is essential. Cultural humility involves ongoing self-reflection and learning. These trends promise to enhance psychology practice. Stay informed and adaptable for truly competent care. Thank you for watching.